We are a team of Australian researchers who have come together with 6 patient advocacy organisations in order to support patients, doctors and regulators to make better decisions about when and how to access treatments that use stem cells. A key focus of our study was hearing directly from Australians living with and caring for those with cerebral palsy about what access to stem cell-based treatment means to them now and in the future. While adults with cerebral palsy told us of their hopes for new treatments at some point in the future, mostly we heard from parents who discussed umbilical cord blood transplants, or UCBs, that might help their children. UCBs are currently an experimental treatment, and at the time of our interviews there were no clinical trials in Australia, so access to UCBs meant travelling abroad. In this short video, we would like to share the main findings using quotes from people who participated in our study. When asked about stem cell treatments, the people we spoke to were knowledgeable and realistic. They considered that there should be access to this treatment in Australia for several reasons, including to ensure that no stone was left unturned to support their child. Families wanted fast access to UCBs because, as one parent told us,
we wanted to use them as quickly as possible. Given neuroplasticity and in the early intervention days of having a child with disability, everybody tells you that the first 5 years are crucial and you're doing everything you can.
Some families saw stem cell therapy as part of comprehensive treatment.
We would see that as an adjunct therapy to all of the other things that my child does, like occupational therapy, play therapy, physiotherapy, all of those things. And they would have to work really hard to make sure that the benefit from that stem cell therapy would be maximised.
Families understood stem cells would not be a miraculous cure, as this quote from a carer illustrates.
So what I'm understanding of the improvements is that they're more likely to be incremental or small improvements, as opposed to going from being in a wheelchair, unable to feed yourself, to suddenly I can get up and run.
Parents considered that decisions about access should take into account evidence that UCB is low risk, with one carer sharing,
I think the way that trials and medicine is running in Australia is very careful, and I think that it is as low risk as you could possibly get for a trial. Obviously, there are risks with absolutely everything, but really the focus when you have a child with a disability is to do everything you can to make sure they can live as full and happy and wholesome life as possible. And so I think that you are always making a calculated risk with doing a risk-benefit analysis when it comes to these things.
Parents expressed trust in the Australian health system and understood that Australian clinicians and researchers want more research and evidence. But they also want the choice, especially those who have collected umbilical cord blood.
We don't have a choice. If we want to use these stem cells, we have to go abroad. And that's just not really fair.
As a result, many parents longed for more research funding in Australia.
There is a huge tragedy when it comes to scientific research, and it's sad that we're just not investing as much as we should. It is ultimately impacting families such as myself because there are no clinical trials available at the moment. I have the stem cells, I have the blood cells, I have the tissue samples, I have the child. Let's go for it. There should be something available, and there's not.
These voices highlight the real-life challenges, needs and priorities of patients. This research shows how vital it is for consumer perspectives to be included in public discussions about access to experimental treatments. Our findings emphasise the importance of ensuring that reliable, complex and up-to-date information is easily available to Australians living with cerebral palsy and their loved ones and carers, so that consumers and their doctors can have nuanced discussions about treatment options, and so that policies governing access to new treatments are shaped by the perspectives of carers and of people living with cerebral palsy. We would like to thank the many Australians who generously gave up their time to speak to us for this project.